Good afternoon and welcome to our daily media briefing. Before we get going, I want to address the concerns that have come up lately regarding grocery stores or restaurant employees who have tested positive for COVID-19. As we talked about this the other day, this is something we expected to happen with community spread of the virus. We anticipated there would be employees in various types of business sectors that unfortunately became sick during this pandemic. That's why we've repeatedly emphasized the simple steps people can take to protect themselves when out in the community, such as practicing social distancing, washing your hands before you eat food or touch your face, and practice common food safety practices such as washing your produce before you eat it. Since early March, our Department of Environmental Health has been working with food facility owners and staff so they know what to do if they have an ill food handler, including the following: sending home any staff that arrives to work and are sick as required by state law, taking their own initiative to close and to follow disinfection and sanitation protocols, and reporting food handler illnesses to the county. This guidance and these protocols have been provided to all of our local restaurants, grocery stores, and markets. These are steps they are following. There is no ongoing risk to the public at grocery stores or restaurants where there have been confirmed cases. And I want to remind restaurants, grocery stores, or markets that have had any situation with an ill food handler to please contact our Department of Environmental Health as soon as possible at 858-505-6814. And that number again is 858-505-6814. That information will be on the DEH website as well. Let me assure San Diegans that it is safe for you to go to the grocery store or to get takeout food from restaurants. It's not only safe, it's necessary, as we need to stay nourished and keep our immune systems strong. And according to the CDC, there is no evidence that supports the transmission of COVID-19 associated with food. Our food systems are safe. So, like all moms say, eat, eat. With that, let's go to our speakers. We'll hear first from Supervisor Fletcher, and then we'll hear a medical update from Dr. Wooten.
Thank you, and good afternoon. I know we're in a situation where at times the days can begin to run together, and I think it is important to note we are just 3 weeks out from our first positive test. We are not yet 2 weeks out from the stay-at-home order. And I want the public to know that every single day is being used to the maximum amount possible. Here at the county, we are moving ferociously on a series of initiatives and efforts that, while we still are in the early days as a region, will position us best for the period when we begin to see greater spikes and greater taxing on our healthcare system. During this time at the county, things that normally take months are getting done in weeks. Things that would normally take weeks are getting done in days. And things that would normally take days are getting done in hours. And I'm incredibly grateful for all of the individuals here who are working so hard to try and protect our region. And we are also incredibly grateful for all of the San Diegans that are stepping up to do their part by adhering to the public health orders, by supporting one another, by staying at home, by essential workers who do go out, ensuring that they're maintaining physical distancing. And in a period of time in which there is so much that we don't know, we routinely get questions about how many actual positive cases are out there, understanding the limitations of testing, and the reality is we don't know. We get questions about what day it is exactly that we will peak and when that will happen, and the reality is on that we don't know. But what we know for certain is that our ability to get through this as a region will be directly influenced by each and every one of us adhering to the orders and making a personal commitment to physical distancing, to hand washing, to following the guidance of our public health experts. We also know that as a county and as healthcare systems, if we work together to increase the capacity of our healthcare system with more beds, with more supplies, with more staff, with more ventilators, that those two things together will prepare us. And so in an environment where there's a lot that we don't know, as we know more, we will continue to share the moment that we do. But I think it's important as a region that we all come together and focus on what it is we know. Taking action to flatten the curve. The actions we're taking to raise the bar, which I'm going to talk about in a little bit, and then the efforts that we all take to help our most vulnerable populations, to help our seniors who may be isolated, to help our communities who may be most economically impacted, to ensure that people don't lose their home, that they have food, to make sure that we are doing everything we can during this period of difficulty. And again, we're very grateful. We're going to go through our charts real quick, and I want to share with you a change in reporting as we continue to refine and sharpen our focus, as we continue to be in a position to provide more data in more real time. Today we are making a change in how we report our cases at the 2:30 briefing. The first slide that you will see in front of you reflects what was updated on our county website last night, which many of you have already seen. This was 84 new confirmed cases for a total of 603. Now, traditionally, when we've briefed these in the afternoon, you've got a new set of numbers that night posted on the county website. Effective today, at these 2:30 briefings, we will be providing you the numbers that will be released later that day. So let's go to the second chart. This chart represents the numbers that we historically have not publicly provided until the evening, and this shows 131 cases, bringing us to a total of 734. And so it is important to note that for this day, we are sharing two sets of data, and moving forward, we will have one set of data that will represent the latest information that we have at this time. I think that this will help not only better inform the public faster of where we are, but will also avoid any confusion regarding something said at the 2:30 press conference versus something that is posted on the website later. So this is our single largest jump, and again, to reiterate, there is not a lot that you can read into day-by-day results. Day-by-day results can be influenced by testing, it can be influenced by batching, it can be influenced by a series of things. What we really want to look for is trends that are weeks over weeks. So let's go to our next chart. This is our testing reports. This shows that presently in San Diego County, there has been at least 10,354 tests. Again, this is not encompassing of all tests, as not all tests were reported to us. We do believe we are seeing an increase in testing, and we are definitely seeing an increase in testing reported to us, and you see that with more than 1,500 tests reported in a single day. And again, these numbers will fluctuate. It is not a situation where day by day you can read a tremendous amount into them. Again, that we are looking at trends. Our next chart just puts into graphical perspective our tests, our positives, our hospitalizations, our intensive care units utilized, and unfortunately the loss of life that you see represented. And we expect, obviously, as the testing capacity goes up, the number of positives go up as well. And we continue to track both hospitalizations, ICU utilization, along with the unfortunate loss of life. The next chart here, just again, is a graphical representation of where we are versus other jurisdictions. Here you can see these are dates since the first positive. And again, we use this to reiterate that because we have a little bit more testing perhaps than some of those jurisdictions did at their point in the evolution, our numbers are a little higher. But we really use this chart to demonstrate the reality that with exponential growth, as you have community spread, you are going to see an uptick in cases. We believe the uptick in cases in San Diego County will continue and will continue for the foreseeable future. But the actions that we are all taking around closing non-essential businesses, around closing schools, around staying at home, around hygiene, are the things that we believe over time can help us flatten this curve and preserve the integrity of our healthcare system. Now we will quickly go to a couple of our outreach effort slides. This one, it just represents the calls. You see the calls both to 211 for help and assistance, a tremendous asset in our region, along with the calls to our nursing line. We've added a new one. This is our EPI calls. These are healthcare professionals who call into our EPI call line. This is for coordination, for information, for questions. You can see a very robust effort there to provide coordination and information sharing. Hygiene kits are being distributed by homeless outreach teams and others. Hand washing stations continue to be installed throughout San Diego County, and 10 portable toilets have been distributed, and as we get additional requests, we will continue to fulfill those. Next, we are going to go to our hotel rooms. And again, to reiterate, I know we reiterate this a lot, but I think it is important to ensure we provide clarity. There are two categories of hotel rooms in San Diego County that are available. One are public health rooms. These are for individuals who have a positive test, who are a person under investigation, or in unique circumstance, an individual with symptoms who is awaiting further evaluation. There are currently 1,585 of these rooms. We have a large supply of them, anticipating that increase in positive tests that is likely to come, and the reality that we need to maintain the capacity that if those individuals do not have the capacity to isolate at home, that we have a place for them where they can go and remain in isolation. Out of those rooms, 106 of those rooms are occupied for a total of 116 guests. There are a couple families that are in the same circumstance and are isolating together. Out of those, 95 of those 116 are unsheltered individuals who have come to us via our shelter or our homeless outreach team. An update from yesterday, because we continue to do ongoing testing, we now have 3 unsheltered individuals who have tested positive for coronavirus. All 3 of those were unsheltered when they came into our system. They did not arrive via a shelter. They arrived via a referral from a public health nurse and a homeless outreach team or from a healthcare provider, but these were individuals who were unsheltered, who are now in isolation in our public health motel rooms. We've also allocated 441 rooms to the Regional Task Force on the Homeless. These are for individuals who have no symptoms but are particularly vulnerable. Out of those, 170 of those rooms are occupied with 294 guests. Some of these are individuals together in a room, and some of these are also families. Families are not the most ideal to be in sheltered situations, and so we are providing motel rooms and making those available for these individuals. Our next chart is just a quick walkthrough of the personal protective equipment that we have distributed to date through the county. Here you can see almost 500,000 N95 masks. This represents masks that have been shipped to our healthcare or other community partners, along with more than 100,000 surgical masks, more than 500,000 gloves, face shields, goggles, gowns. There are other things that we distribute, but we wanted to take the largest ones and the biggest categories to share. But to date, you can see that the County of San Diego has distributed more than 1.1 million individual items of personal protective equipment to our partners throughout the region. We continue to acquire more. We make requests from the state, we make requests from the federal government. We also go into the open market and purchase these items. We bring them in, we sort them, and then we fulfill as best we can every request we get with an understanding of trying to assess the proper burn rate along with planning so that we have enough of this to get us through this episode in crisis. The next chart is the last chart we're going to share, and this is a new one for today, and this is one that I think is particularly important because of all of the things that we track and all of the things that we know that ventilators are perhaps one of the most, if not the most important item when tackling the coronavirus challenges. Available today is 481 ventilators. Now, to put this in context, this is not the total number of ventilators in hospital systems throughout San Diego County. This is simply the number that are available. 19 of our 23 hospitals are reporting to us daily the number that are available for usage. We expect that this number will fluctuate daily. Perhaps it'll fluctuate many times during the day, and we're committed to sharing with you a snapshot once a day of how many of these are available, as there are more patients that need them for a variety of functions. Coronavirus is not the only reason someone might need a ventilator. Then this number could go down. As less people need it, it could go up. As our health system partners acquire more of their own, it could go up. And we have 4 of our hospitals who we are in contact with who we believe soon will be reporting their numbers. They are smaller systems, so as they report, we think the numbers will go up, but probably not significantly. But right now in San Diego County hospitals, countywide, we have 481 ventilators available. The next line on here is ready to deploy. These 75 represent 75 ventilators we currently have in the county. They have been maintenance, they have been serviced, they are tested, and they are ready to deploy at a moment's notice if needed. We will continue to monitor and assess the need, and as needed, we can deploy those. The line below that is 69 ventilators that the county owns that have been sent out for maintenance. We want to make sure that ventilators, when they're needed, are in tip-top condition and are functioning and have been tested. And so those have been sent out to be serviced every day. We get between 5 and 7 of those on average back. As we get those back, they will move to the ready to deploy number, and the number in service will decline. We've also requested 600 ventilators from the state of California. And as those arrive, again, we will test those, we will assess those, we will make sure that they are ready, and when we get those will go into our ready to deploy number. And then we have ordered on the open market, we have been scouring literally the planet for available ventilators, and we purchased those ventilators. To date, we have found 125 that we have purchased, but they are not ready to deploy until we receive them and we test them and we inventory them and we make sure that they have all of the components necessary. And we are aggressively looking and out there in a very competitive market trying to acquire more. But this is a snapshot of ventilator capacity in San Diego County today with what is available, what we have in ready reserve, along with a forward look at things that we're trying to acquire and what we hope to bring on board. Before I turn it over to Dr. Wooten, I wanted to spend just a minute talking about efforts designed to raise the bar. We talk a lot about flattening the curve, and that's what each and every San Diegan is doing to slow the rate of transmission in hopes that as individuals get sick, that hospital capacity that is needed is there. We have all seen in other parts of the country and other parts of the world the incredibly tragic situation of hospital systems being overwhelmed, of not having the capacity to meet the need. And this is what motivates us daily to put in place the efforts we have to flatten the curve, but also what motivates us daily to try and raise the bar of available healthcare services. We never want to be in a position like we see other jurisdictions are, and so we are using and have been using these early days to move aggressively to make sure that we can acquire and expand and enhance and provide as much healthcare capacity as possible. And we are fighting very hard to do this. It is important to note that raising the bar of healthcare capacity is just not as simple as having a machine or having a structure or having the staff to run it. The reality is you need all three. You've heard it referenced before. The 3 S's we talk about are structure, staff, and stuff. And each of those presents its own unique challenges, and each of those are challenges that we confront and tackle every day in trying to raise the capacity. Structures in general are kind of the easiest things to get these days. There are a number of buildings that are empty, and we appreciate the number of folks who have offered their buildings for healthcare facilities, but a structure by itself does not help us raise the capacity of the healthcare system. In order for a structure to provide new healthcare opportunities, it must be accompanied by the other two, the staffing and the stuff. We have been told by the state of California that we are in line to receive a 250-bed mobile field hospital, federal asset deployed by the state of California. This is the equipment, this is the stuff that would go in a structure. The Army Corps of Engineers has been in San Diego assessing multiple sites to determine what might be the appropriate location for those. We have also been working with health partners and with our Medical Reserve Corps, and we are grateful to so many San Diegans who stepped up and signed up to be a part of our Medical Reserve Corps for how we can put together the right configuration of the right structure with the right stuff from the state of California and the right staffing in partnership with our healthcare systems and the Reserve Medical Corps. If successful when brought online, this would create 250 new hospital beds that would be a regional asset. We have also requested from the state of California a different asset, which is a 25 hospital bed unit. This unit is a little bit easier to deploy and that it is obviously a little bit smaller, but it also comes with the staffing. And so we are assessing the viability of where we might place that, along with waiting confirmation that we will actually receive that as well. But we're not simply limited by what we're given by the state or federal government. There are opportunities that present itself to us where we can take a creative approach in a unique partnership to raise our hospital system capacity. One of those that we are actively moving down the road towards opening is a partnership with the University of California, San Diego. And I want to thank the Chancellor, Pradeep Khosla, for his incredible willingness to partner in making an empty dorm available to San Diego County. We will take this empty dorm because there are no students there, we will create an alternate care center. This will be staffed with a combination of nurses, along with potential telemedicine connection to doctors. And we believe that between 200 and perhaps 250 folks who are presently in our hospitals who are too sick to go home, but not sick enough to need to be in the hospital, could be moved to this facility. That would free up between 200 and 250 hospital beds that could be used for people who need a higher level of care. And we are working diligently to identify the supplies, create the protocols and procedures, along with lining up our medical personnel to stand up this operation. And we anticipate this being open in the near future, and we will continue to do it. That will help create more hospital capacity. In addition to that, our hospital systems are doing incredible work, each and every one of them, and we coordinate daily with all of them, and we are incredibly grateful for each and every one of them that are really looking at their individual hospital configuration. And they're looking at how can they reassess unused space, how can they maybe consolidate some groups of patients into smaller spaces or into 2 rooms. Rades is taking a particular thing about changing their traditional age of admission to be able to take more patients they don't historically take, which again increases our regional capacity. And so we are grateful for each and every one of our hospitals that is working very hard to increase capacity. And then the final point on this is we are actively reaching out to non-hospital medical providers. These would be things like outpatient surgery centers that should not be operating because those are generally elective procedures, to assess what is your capacity, what are the supplies you have, do you have ventilators, do you have staff, and how might we incorporate those efforts into our broader coronavirus response. That's structures. Staffing, the governor just announced an initiative to expand healthcare capacity in our state. That has the added benefit if he's willing to pay those folks. We have previously called upon San Diegans with healthcare experience to sign up, and we are grateful for the hundreds of San Diegans that have joined our Reserve Medical Corps, and we ask you to stand by and be ready. You could be needed to staff one of these new entities. You could be needed to assist in a motel room or a different type structure, or you could be on call to fill in for a traditional healthcare worker who is either ill or needs a break. And we continue to call on individuals who have medical experience, maybe retired, not working as much, maybe you went into a different line of work. We still would love for you to go and sign up. And the state of California has a new website for that, which is HealthCorps, HealthCorps.ca.gov, where you can sign up. And then the last point surrounds PPE. This is the stuff. We mentioned earlier the aggressive efforts we take to acquire more things to staff and to make all of these efforts work, and those will continue. In the coming days, the County of San Diego, Rady Children's Hospital, and the Rock Church are working together on a collaborative approach where individuals who might have some of these in their possession will have the ability to donate and be able to provide those, and it'll be another opportunity. In everything that we do, we are thinking about how we integrate the health of the individual across all of these spectrums, whether that is a public health nurse and a homeless outreach team, whether that is nurses that are staffing motels, whether that is the integration or the coordination between our skilled nursing facilities and our hospitals, the utilization of our outpatient surgery centers. We are taking a holistic look at the entirety of the healthcare system in coordination with all of our partners in terms of how we as a region can provide the most healthcare capacity to hopefully ensure that the combination of flattening the curve and raising the bar will put us in the strongest position to work through this. So with that, I would like to turn it over to Dr. Wilmer Wooten, our public health officer. Thank you.
Thank you, Supervisor Fletcher. Welcome, everyone, and happy Cesar Chavez Day. I will now provide COVID-19 stats for global, national, state, and local levels. Midday today, based on the Johns Hopkins dashboard, globally, the novel coronavirus has resulted in over 800,038 positive COVID-19 cases, including 41,500 deaths. Nationwide, there are over 181 positive cases, including over 3,600 deaths. This is the largest number of cases for any country. In California, there are 7,477 positive cases, which includes 150 deaths. And locally in San Diego, at the end of the day, we will report 734 positive cases, 131 more cases since yesterday's number of 603 cases. This total includes 9 confirmed deaths, although we also have 1 probable death. But on our stats and graphics, we will be reporting, at least for the time being, confirmed deaths. As it relates to gender, 317 or 43,000, or 43% of our total cases were female. 414 or 56% were male, and for approximately 0.5%, we could not identify the gender. 136 or 18.5% of our total cases have been hospitalized. 56 or 7.3% have been admitted to the ICU. And the 9 confirmed deaths represent 1.2% of the total San Diego COVID-19 cases. My most sincerest condolences go out to the families and the loved ones of all of the individuals that have lost their lives to this pandemic. Of the age distribution, 448 or 61% are between the ages of 20 and 49 years of age, showing that this infection affects all ages. There are 157 or 21.4% of the cases being 60 years of age and older. Also posted on our website is a link for cases by city and municipality, and this is updated on a daily basis. I ask you again, both as a San Diegan and as your public health officer, to do all that you can so that this community collectively helps to flatten the curve. We have not yet reached the peak of our curve, and we should all expect to see our numbers continue to increase in the days to come. By now, everyone has heard the importance of social distancing and how important that is to flatten the curve. This call for social distancing is really a call for physical distancing. It is not a call to cut yourself off from those you love, your family and your friends. Quite the opposite. In fact, none of us should cut ourselves off from others. While physical distancing is vital, and it is a vital action to flatten the curve, social connection is also vital to both our physical and mental health, as well as our well-being. If there is ever a time for all of us to act like millennials, it is now. Let's all use technology to maintain social connection. Please do it for yourself, for your loved ones, and for your neighbors and your family. Stay home, stop the spread, and save lives. But also stay connected with all of the tools that you have available to you. Before closing, I want to also address another action you can take to be and stay prepared. Keep your inhalers and other prescription medications close on hand in case you need to be transported to the hospital. Having your medications with you will help healthcare providers know what medications you are on, and this will help to alleviate any confusion regarding prescriptions that are needed if you are hospitalized. So thank you for your attention, and now please welcome to the podium Dr. Eric McDonald.
Thank you, Dr. Wooden. I wanted to give a brief update on the cruise ship situation. Approximately 1,200 passengers successfully disembarked yesterday from the Celebrity Eclipse to transit out of San Diego County to their homes across the country to start 14 days of CDC-recommended quarantine. All of these individuals reported no symptoms and had no fever prior to disembarking. Disembarkation continues today, and this will end by midnight tonight. The ship is expected to depart the port in the early morning. One passenger who was medically evacuated from the ship to a hospital yesterday morning had cardiac and respiratory complaints. This patient was transported using precautions for COVID and was later determined to have the virus by testing at the hospital. This patient remains hospitalized in serious condition. 3 crew members on the Celebrity Eclipse who had been isolated on board with respiratory symptoms were tested yesterday by our public health laboratory for COVID. All 3 crew members were positive for the virus. Close contacts of these cases had been previously identified and quarantined on the ship. One of these crew members was transported to a local hospital overnight for further care, and I do not have an update on that person's condition. So in summary, 1 passenger and 3 crew members on the Celebrity Eclipse have been diagnosed with COVID-19. And I'll answer questions later time, and I'll turn it back over to the supervisor.
Okay, we'll go directly to the calls. Again, if we don't identify you by name and outlet when we call your call up, please make sure you do so. Let's go to the first call.
KUSI, will you please state your name and question?
Yes, I have 2 questions. It's Sasha Fu with KUSI TV. To follow up to Dr. McDonald on the cruise ship situation, we have evidence at KUSI that the Port and County knew yesterday before the afternoon county briefing that someone on board that cruise ship had the COVID-19 symptoms and, as you said later, tested positive for the virus. Why was the media, though, not made aware of this situation, and why were passengers still allowed to disembark?
I believe that I mentioned yesterday that there had been a patient who'd been transferred directly from the ship to the hospital. So I don't think that that's true, that the media wasn't informed. And again, we didn't know the full condition of that patient until the patient arrived at the hospital. We did it with precautions to make sure that there were no exposures in San Diego County. And unfortunately, we did learn late yesterday that the individual had COVID-19. This specific case and the 3 crew members that were identified in my statement really had no effect on the disembarkation process for those who were leaving the ship. Those individuals were not close contacts to these individuals. They were also individuals who were asymptomatic and without fever. And the current CDC recommendation, which we endorse, is that individuals who come from cruise ships should be disembarked and expeditiously sent to their homes to start 14 days of quarantine there. A common question is, why are we doing this differently than perhaps a month ago when there was a federal quarantine here at Miramar? And one of the things that was learned from that experience was that it is safer and faster and actually better for all involved for individuals to quickly leave their cruise ships and go to their homes to complete quarantine. The other reason is that it's a different stage of the outbreak. We were doing federal quarantine at the beginning of this evolution with COVID-19, and that was when we had a containment strategy. We have now moved into a mitigation strategy with widespread community transmission of COVID. So there's a different condition in the community. And so therefore, having these individuals leave the ship, go straight to their homes to complete quarantine, is the safest, most effective thing for them. It's also the best for San Diego because these individuals are in their home jurisdictions and would not need to be cared for locally.
My second question is not related to that. It is about the mobile field hospital that was mentioned, the 250 beds. Which sites are being considered as locations for that mobile field hospital?
Okay, Supervisor Fletcher will respond to that question.
We're assessing a variety of sites to determine what may be most appropriate, along with what the Army Corps of Engineers may be most suitable. And when we get to the point that we're ready to begin to move forward, we will share the information with where that is. But at this point, it's all preliminary assessments of a variety of different locations, so we don't have anything to report out now. Thanks.
Thank you.
Okay, let's go to the next question.
NBC7, can you please state your name and question?
Hello, everyone. This is Artie Ojeda from NBC7. Can you confirm any and all details of a cluster at a pharmacy in El Cajon, including whether the pharmacist tested positive and whether the death of a San Diego resident in Riverside County is connected to this cluster at this pharmacy?
Okay, Dr. McDonald will answer that question.
Thank you for that question, and I think I've tried to address this in previous news opportunities, but I'll address it again today. The information that comes to the epidemiology program comes in confidential morbidity reports, and we will not confirm specific identifications of individuals or specific locations when these questions are asked. We will confirm a specific location when there is a need to inform the public to take a different action to protect themselves. And the actions the public needs to protect themselves in all of these cases, and in this specific instance, is to stay at home, to absolutely remain home and isolated if sick, to access care when needed, and again, to do all of the social distancing messages that were so nicely described earlier by the earlier speakers.
Okay, so again, you have, Dr. McDonald, in the past confirmed like the number of cases in clusters. So can you confirm whether or not there are 4 cases and 1 death connected to this cluster? And also, this is a very popular pharmacy in El Cajon's Chaldean community. Wouldn't there be a public safety concern and a need to identify and confirm, more information?
Well, I can tell you that we work with each location that has a cluster, especially those that are businesses. We ensure that those businesses have done appropriate cleaning, that anyone who is working at that business has no signs and symptoms of illness. And I will say that this is the general approach which has been applied in all the clusters that have been mentioned in the media. And again, that's a general answer to the specific concern is for a specific risk on a specific location. Again, if the public is doing what we ask them to do, which is to stay at home, socially distance, wash their hands, these are the appropriate precautions that should be taken. If we learn in our investigation that there is a different intervention that needs to take place, then we will do so. An example would be a food location in which there was a different risk to specific food customers. I will hasten to add that has not been identified thus far to date. Or if there was a business that was giving products to individuals that we felt needed to be specifically recalled or cleaned or of concern, we would make such a notification.
All right. As you have in the past, Dr. McDonald, can you at least confirm the number of cases and whether or not there was a death involved in this cluster?
Yes, we again have a cluster in that area of the county that does have a death associated with it, and that's as specific as I'll be. Again, we also, as one of our tools that we provide businesses, is to give them a templated letter that allows them to, in fact, notify their customers and to notify their clients or employees as to the situation, and that is often how you find out about these, is through that mechanism. And again, it is a different situation for them to be releasing information about their own business and what they're doing to protect the public, and it's best that you address those questions to them.
Okay, let's go to the next question.
News 8, will you please state your name and question?
This is Carlo Cicchetto from News 8. I had just 2 quick ones. The first quick one I wanted to ask, a lot of people have reached out asking, why can't we break down cases by zip code? We have by city, but geographically, the city of San Diego is enormous. So it's not really useful for people to try and figure out what is going on in their community.
Okay, Supervisor Fletcher will answer that question.
Thank you. To date, we haven't released the information by zip code because of the simple reality, as we've stated multiple times over, is the number of positive cases we have, we believe is severely underrepresentative of the total that are out there. You've heard Dr. McDonald speculate that it is perhaps 10 times as high. And so the reality is the public should operate under the assumption that there are positive cases in every single zip code. And if you knew that there were positive cases in every single zip code, then we would ask you to do the things that we have advised around staying at home, physical distancing, washing your hands, and those types of episodes. But because it is of concern and because it has repeatedly come up, within the next day or two, we will provide a breakdown of these by zip code. But I want to reiterate, and this is really important, and it's really important that this be put in the proper light, that if somehow your zip code does not represent any positive cases, that does not mean there are no positive cases in your zip code. It just means there are no positive cases that have been tested in your zip code. But you should operate under the assumption that there are. If there are a large number of positive cases in your zip code, that again does not imply any inherent danger because of your zip code, because again, it is not an airborne transmission. If your neighbor is positive, as long as you stay 6 feet away, as long as you wash your hands, as long as you maintain physical distancing, you can protect yourself. And so we will, out of an abundance of transparency in the coming days, be providing a zip code breakdown. But it is really important that folks understand what that data represents. It is just a snapshot into the limited testing that we have. And it is also important for everyone to understand that regardless of what the number is in your zip code, the advice and guidance of what you do to protect yourself is exactly the same. And so that is a point we're going to continue to reiterate, and we hope that it's a point that when that data is presented, that aspect of what that data means is also transmitted to the public to make sure that everyone understands the guidance we've given, the things that we've asked are the things that every San Diegan in every zip code, regardless of how many positive tests there are, can and should be taking.
I appreciate that, and I feel like you guys have gotten that message out at these news conferences, so thank you. The second thing, it's been repeatedly stated there are enough masks for local hospitals, but we in the news industry keep hearing from professionals who don't believe that's the case. They say they're not being given masks if they request them, except for certain specific scenarios, and are being told they can bring their own masks into work. Does that sound like there are enough masks for healthcare workers in our community?
I'm going to ask Rob Sills, the director of our Medical Operations Center, to answer that question.
Okay, Carlos, thank you for that. We continue to get additional shipments from the state and the federal government. We received 2 shipments today. We inventory and we fill orders. I just know from the slide that Supervisor Fletcher put out previously, we're throwing out the resources as they come in. Are we able to fill absolute every request? No, we're not. Well, we're doing a very judicial and thoughtful process to get the resources to our first responders, our clinicians, our healthcare workers, and those that need it. So we continue to make requests to the state, we get them in, and we turn it around and we fulfill requests working with each of the hospital's incident command systems in order to do that.
Thank you.
Okay, let's go to our next question.
CBS 8, can you please state your name and question?
We got a couple of CBS 8 people. So my question has to do with the cruise ship. You mentioned 1 passenger, 3 crew members testing positive, and we were told all along, throughout the day yesterday that there were no one on board with any signs or symptoms. So, many of the passengers got a letter this morning saying someone tested positive and they need to check their fever spikes and that they could have been in contact with the virus. So, obviously, surprised to hear this news. They were all feeling really confident and safe on board that ship, actually safer on this than they did when they disembarked. So why is that? Why are we getting this confirmation today about those 4 people, especially since, everyone was really being reassured on the ship that they were safe and no one had symptoms? Okay,
Dr. McDonald will answer that.
Yes, actually, I believe really that's essentially the same question that was asked before, which is, we stated that those individuals who disembarked had no signs and symptoms. If you do the math, there are 4 individuals we're discussing here out of a number of individuals on the ship that is over 3,000. So the overall health of the ship is excellent, and there were specific individuals who were identified late yesterday as specifically having the virus, which we have briefed you on today. So I don't think that your characterization of what we have communicated before is exactly accurate. The individuals who are on the ship were given information that directed them that there was a possibility that they could have been exposed to COVID on the ship. That is what every cruise ship passenger who has been in international waters is recommended by the CDC to be instructed upon and to act upon when they go home. And so it's important to focus that these individuals who left the ship were in fact, there's a lot of feedback on something, sorry. These individuals were instructed to go to 14 days of quarantine precisely for the reason that they were not at zero risk, but they were at some risk. And I think that's important to emphasize.
Okay, Dr. McDonald, don't go too far, because I think the first text question is going to be directed to you.
Sure.
Yes, thank you. This is from Kelly from CBS. Do you believe COVID-19 cases were here in San Diego County before the first confirmed case in March? And do you think some of those cases were possibly misdiagnosed as the flu or another respiratory illness?
Well, I absolutely believe that the virus was present in San Diego before our first confirmed case. Those first cases were identified as travel-related because that's why we were looking for them. But there may well have been other travel-related cases that introduced the virus into the community and were undetected. I wouldn't use the word misdiagnosed because, again, clinicians are very good at diagnosing viral conditions, whether it was specifically this virus that was connected to the signs and symptoms that somebody might have had with a pneumonia in San Diego, say in January, wouldn't have been able to be recognized or diagnosed because it wasn't on any physician's radar locally. I can say that in China, they've done some research to show that even though this virus was detected as a cluster towards the end of December of 2019, it is likely that the virus was present and circulating as early as late October of that year. And so following that through, it is extremely likely, in fact certain, that the virus was present here in extremely low numbers. And it is important to know now that the actions are the same because it is still likely being under-detected in San Diego, which is why everyone must do the actions that have been recommended.
Yet another question. This one I know you touched on yesterday from Gina Yarbrough of the San Diego County News. 2 Sprouts employees in Carlsbad tested positive for COVID-19. What is the county doing to notify shoppers who may have been exposed to the virus?
I think this also reflects back on the answer I gave about the previous business that was acted upon. We're not going to be discussing specific instances like that. We give businesses templates, and often businesses on their own will go ahead and release information to their customers and employees. I would say that organizations that do that rapidly, when they learn of a case, even if the case wasn't working while symptomatic, wasn't even able to be transmitting it to their employees or customers, that transparency to show that a case may have existed and the actions that they have taken by ensuring other employees and are in fact asymptomatic and that they have done cleaning, I think speaks highly of those organizations when they communicate that.
Okay, our next text question deals with one of the charts that was shown by Supervisor Fletcher, so he'll be coming up to go over that.
Yes, Supervisor Fletcher, this is from Will Huntsbury from the Voice of San Diego. You showed a chart that compared San Diego's curve to other regions, including Washington and New York. Our curve looks substantially different and seems to rise earlier. Can you please talk about why that might be?
Well, we don't know exactly why that is. There is a existing hypothesis that has some validity that because we started later, those other jurisdictions started much earlier on their first date when there was even greater limitations in testing. And so based on where we are relative to everyone else based on the day, we think that it's entirely possible that we have more testing per capita than some of those folks may have had per capita at that point, which is why we're seeing a greater uptick earlier. It could be greater awareness, it could be more people seeking out help and assistance, it could be more people seeking out medical care. But I think what's the real point of that, I think, is that it is also comparing us against some very large jurisdictions and entities, is really the point that we try to drive with that slide is that based on the concept of exponential growth, that we do believe we will continue to see significant increases in the foreseeable future here in San Diego County, and to really prepare the public for that, and also to reiterate that an increase in test is natural in a virus that is this contagious. And that the efforts that we're doing around social distancing, physical distancing, around everything we're doing will, of course, be slowing the spread. When fewer people interact with one another outside of their family units, it will slow the spread and transmission. And so we'll continue to monitor it. We're continuing to work through modeling options. We're continuing to look at data relative to testing, relative to what we know, what's happening, and we hope to continue to be able to refine these as we move forward. And as there's more things that we begin to know, then we hope to be able to answer some of these questions with a greater degree of specificity once we have more data.
Okay, the next text question is concerning modeling, and we're going to ask Dr. McDonald to respond to that question.
Or I think actually Dr. Wooten. Yes.
I stand corrected.
Thank you. This is from David from Channel 8. Does the county modeling still show the number of hospitalized COVID-19 patients reaching 7,000 sometime in April or May?
So that is information that Dr. McDonald presented about 10 days or so ago. Right now, we're looking at various models, and we have various researchers at UCSD looking at all of the models and comparing them to see what is the best prediction. We also have other researchers working with us to complete modeling efforts looking at individuals that have underlying medical conditions to see how that impacts. So right now, the information that was provided 2 weeks ago, we are looking at various models to see if that information holds up.
Okay, and Dr. Wooten, I have another question from Rachel. Do you think the incubation period is 14 days, or could it be longer?
Well, the information that we have from the Centers for Disease Control and WHO is based on the incubation period of MERS, the Middle East respiratory syndrome. That's the information that we have, and we always have to go with the best information that we have, and that is what we have at this time, and that's the information that we are using.
All right, thank you, Dr. Wooten. I have a question from Nada from CBS, and it is a cruise-related question. She is wondering why an ambulance was at the ship at 11:30 today. Was that someone showing symptoms?
I don't know what ship you're talking about, and I'm not sure if you can give me some more details. Again, we are aware of a case that was evacuated last night from the Celebrity Eclipse.
Yes, that's
there is also a patient that was brought to a hospital early this morning from a ship that is off the coast. And we don't know whether that's related to COVID or cardiac symptoms. It's actually thought to be cardiac, but all patients coming off of the cruise ships are being treated as if they could have COVID. We're waiting for more information on that. And again, specifically the time on this one, I can't tell you with precision which one that is.
I do have a question from Paul Sisson from the Union Tribune regarding the cluster that included one death. Has the county's investigation so far shown that social distancing recommendations are being followed?
I guess the question means specifically at that site. When we have any report of a single case in a congregate facility, we will go and provide recommendations on infection control, social distancing, and how to deal with individual patients to see if any are having symptoms and how to collectively deal with the congregate setting. So we often find places, along with our CDPH colleagues from hospital-associated infection and from licensing, we're often able to improve the procedures that are in place and reinforce practices that are already occurring.
Okay. I believe that completes all of our text questions. I don't think we have any additional call-in questions. So let me close with some good news. I think we're all looking forward to having some good news once in a while. And I just want to announce that last year, in fact, it was December of 2019, the Board of Supervisors voted to approve the purchase of a vehicle that we send out to the community groups to provide vital health services. It was to support our vision to improve the region's health, the vision we call Live Well San Diego. Officially, the vehicle is called the Live Well San Diego Mobile Office, but we like to refer to it as the Live Well on Wheels. The idea was to deploy the Live Well mobile office throughout the community so residents can get a variety of health and community services right there in their own neighborhoods. Those services include public assistance, veterans programs, public health, behavioral health, housing, aging and independent services, and homeless services. When we proposed this idea, we thought we could also use the mobile office for emergency response. Well, as we all know, a crisis is upon us, and we need it now. So that office will soon roll out in response to the COVID-19 pandemic. Its debut will be to serve as a medical and public health command center to respond to this community emergency, so we would encourage you to keep an eye out for it. And speaking of Live Well, I want to remind everyone about our great new resource, the Live Well at Home webpage. This webpage is for the people of all ages with learning tutorials, videos, activities to help keep you stay at home and to keep you also both physically fit and mentally healthy. Since its launch last week, it has received 11,400 page views. It can be found at our COVID-19 website, coronavirus-sd.com. We encourage you to check it out. And as we always say at the close of these, we want to urge everyone to live well, to stay well, and to stay at home. That concludes our media briefing for today. We'll be back here at 2:30 tomorrow afternoon. Thank you.